and happy Valentine's Day. February is Heart Health Month, and what better way to kickstart this month rather than a proposal concerning heart health? A proposal that would require insurance to cover the CTT-CS, which is the Coronary CT Calcium Score. A few facts that I recently learned about heart disease is it is the #1 killer of women. Women 20 years old or older, 44% are living with some kind of cardiovascular disease. And cardiovascular disease is the #1 killer of new mothers, and over 1/3 of maternal deaths are caused by cardiovascular disease. So it is something to take very seriously. So today we stand before you to shed light on a medical advancement that has revolutionized the detection and prevention of heart disease, the coronary CT calcium score. And I will be referring to it as the CTT-CS. Heart disease remains the leading cause of death worldwide, claiming millions of lives every year. But what makes it more alarming is often the symptoms go unnoticed until it's too late. However, with the advent of the CTCCS, we now possess a powerful tool to detect the early signs of heart disease, enabling proactive intervention and potentially saving countless lives. So why is the coronary CT calcium score so important? Think about it as the mammogram for the heart. First and foremost, it provides an accurate assessment of the health of your coronary arteries. The scan detects the presence of calcium deposits in the walls of these arteries, which are indicative of arteriosclerosis. That's a tough word for me. The building of plaque that narrows and hardens the arteries, leading to reduced blood flow to the heart. Identifying these calcifications early on allows healthcare providers to intervene promptly, implementing lifestyle changes, medications, or other interventions that prevent further progression. The CTCCS coronary calcium score offers a non-invasive and rapid means of evaluation. Unlike traditional angioplasty, which involves inserting catheters into the arteries, the CT scan requires no incisions or anesthesia. The patients simply lie on the table with a scanner capturing the detailed image of the heart. This not only reduces the risk and discomfort associated with invasive procedures, but also makes it accessible to a broader population, including those that may be reluctant to undergo a more invasive test. The CTCCS scan provides invaluable information of risk stratification. By quantifying the amount of calcium present in the coronary arteries, healthcare providers can assess a patient's risk of experience a heart attack or other cardiovascular events in the future. Armed with this knowledge, they can tailor treatment plans and lifestyle recommendations to each individual, minimizing the effectiveness and preventative efforts. So let me share with you a quick personal story. My story is, I was sent for one of these scans, and they didn't find that I had calcification in my arteries. I was a 0 on the score, but what they did find is something that can be life-threatening, aortic aneurysm. That aortic aneurysm, depending on the size, can be life-threatening, it can be hereditary, and can require immediate surgery. That is something that would have never been picked up, nor would I have never known if I did not have this scan. And the big issue is right now, this is covered by Medicaid in the state of Connecticut, but private insurance does not cover the cost of this simple test. And it's not that expensive of a test. It's between $100 to $400, depending on where you get the test done. So this bill is asking that insurance cover the cost of this preventative test. The imaging technique has been highly predictive for future cardiovascular events. Research indicates that the extent of coronary artery calcification correlates directly with risk. The coronary CT calcium scale empowers patients to take control of their heart health. By undergoing this screening test, individuals can gain insight into the coronary arteries and the factors contributing to their potential disease. Armed with this information, you can make informed decisions on your health care. You can change your lifestyle with diet, regular exercise, quitting smoking, and it also provides an opportunity for doctors who may be prescribing a statin to not have to prescribe medication if you come back with a score like I did of 0. Many patients are hesitant to take a statin because of the side effects that are perceived or actually realized by taking a statin. Taking this test would either allow the doctor to be able to encourage someone to take a statin, or the decision could be made that you do not need medication. So cardiovascular coronary calcium scan represents a major breakthrough in the fight against heart disease, which again is the #1 killer of individuals worldwide. Its ability to detect early signs of arteriosclerosis provides accurate risk assessment and empowers patients to make the right and informed proactive steps to change their heart health. By embracing this technology and requiring insurance to pay for this test, it will be an integral and routine clinical practice that we will hopefully be covered by insurance and will significantly reduce the burden of heart disease and save countless lives here in Connecticut and if other states follow across the nation. So I would like to thank you for listening, and I'd like to now introduce the co-chair of Public Health, Senator Anwar, Dr. Senator Anwar.
Thank you. Good morning, everyone. Thank you, Senator Summers, for organizing this, and thank you for raising the awareness of something that's very critical. There's a cost of doing something, and there's a cost of not doing something. Right now, it's very clear that the cost of not performing the CT scan for calcium score is far more than the cost of doing it. And then right now, thankfully in the state of Connecticut, Medicaid does cover this, but a lot of patients, a lot of people who have insurance, the insurance isn't covering it across the board. And that is actually part of the problem. So the heart of the matter on this special day, on the Valentine's Day, where we talk about the heart, we need to commit ourselves to focus on making sure that we protect the hearts of our constituents. Even if a person does not have the risk factors, age is a risk factor. Being of a certain gender or postmenopausal is a risk factor. These are situations where we can find out from calcium scores what's going on with an individual's plaque buildup. And sometimes you can have all the tests appropriate, but because of the risk factors, the familial risk factors alone can put a person at a risk. So asymptomatic patients can get the CAT scan, get the calcium score, and then subsequently get intervention, because protecting the heart becomes very critical. You can intervene, you can prevent this. This is still #1 cause of death. And as we are trying to control this #1 cause of death, this non-invasive test is a very important tool, and I am honored to stand with my colleagues to raise the awareness on this issue, but also ask the insurance industry to take care of the citizens of our state and cover this important test. Thank you.
Thank you, Dr. Senator Anwar. I'd like to now introduce Dr. Senator Gordon.
Good morning, everybody. Happy Valentine's Day. Thank you, Senator Summers, for letting me be here and work with you on this very important matter. When we talk about heart health, we're talking about that every day for the people in Connecticut and in this country. And as we've heard, dying of heart disease is still one of the top reasons that people in Connecticut pass away. We know that heart disease has a huge toll on people. It also has a huge toll on medical costs, because when we find out about heart disease too late, we have to treat all of the ill effects of it, a lot of medications, a lot of invasive procedures. If we can find things early, and I'm a big fan of preventative medicine, something that's non-invasive, that's been proven, such as the CT coronary artery calcium score, when we can find out about people's risks early, we can intervene. And when you intervene early, not only do you save lives and you help people live longer, better quality of life, but also the overall burden on the healthcare system is less, because we're not waiting to react to illness. We're being proactive. And a couple of examples that I often cite about why we want to prevent things is, we all hear about mammograms. That's been proven over decades that when you do mammograms, you can actually save lives and intervene. We talk about colonoscopies, and we encourage people to get those. That's a preventative test where we can try to find things before people actually get colon cancer, or they get it at such an early stage, we can intervene. And the same for CT coronary artery calcium score. It's more information that people have but their doctors and health professionals have to intervene each individual at a time. And as we've also heard, it's not an expensive test, it's not an invasive test, so very easy to be able to do. So if Medicaid does cover it here in this state, there's no reason private insurances should not cover it as well. So I'm very proud to stand with my colleagues and Senator Summers for bringing this to all of our attention and seeing what we can do to really make a difference more and more in the lives of people in Connecticut. So I'm very happy to be here and support this. Thank you.
And now I'd like to introduce Senator Steve Harding.
So thank you, Heather, and being amongst such healthcare champions in Dr. Gordon and Dr. Anwar and a healthcare advocate and Senator Summers, who's really led the way on so many healthcare policies, particularly related to women's healthcare. It is such an honor to be with these three individuals. Frankly, when they support these issues on health issues, I know where I need to be. And standing right next to them is such an important part. Even though I am a lawyer and I wore an orange tie, I am 100% in agreement with these three in terms of promoting this policy. I want to thank Senator Summers for her hard work in championing this effort. I look forward to an opportunity to have a public hearing on this, to testify on the bill, and ultimately work to get it through committee and pass in both chambers. With the help of these three individuals, I'm very certain that will happen. This is going to save lives. Not only is this going to be more economically efficient for the healthcare industry in terms of preventative medicine that Dr. Gordon so aptly mentioned, but this is also going to save women's and for that matter, men's lives as well. And so this is an effort we, in my opinion, as legislators have an obligation to get behind. I'm very much looking forward to that. And one thing, on Valentine's Day, I know Dr. Gordon well enough. He knows the most important person in his life every day and on Valentine's Day is a cardiologist. So it's fitting that he is here promoting this particular issue here today as an oncologist, promoting something that is so important to cardiological health in our state. So thank you very much, and thank you for all those championing this effort.
Thank you. So we will open it up to questions if anybody has any.